dentists earn more money the more treatments they do. Does it make sense? You should think about how can I make my time more meaningful, more rewarding, more effective. And these are all practical pieces of information that are not taught in dental school. While working with animals, I've used neural models to study the association between periodontitis and psoriasis. Everybody told me, you get to the 4th, 5th year of dental school, you start to do something and then you're gonna like it. So I waited.
Did you not get that moment?
I didn't get the eureka moment.
Wow.
To what extent can one's oral health affect the wider body?
Periodontitis has been associated to approximately 57 systemic diseases.
When learning to do perio in university, and maybe your technique is not 100% in the beginning, so you're sitting there scraping and you're like, is this really doing anything?
Am I really doing the right thing? If a patient tells you that they love smoking, that they're heavy smokers, tell them, you know that smoking is beautiful. The longer you neglect the perio, the more the treatment that you're gonna need at some point, right?
Today's guest is a record breaker. She completed a PhD in less than 3 years and has already been named in the Forbes 13 to 30 list as the first dentist in history for the science in the healthcare category. Dr. Crystal Marruganti is an award-winning researcher, lecturer and dentist with over 50 publications to her name, and she has gained recognition through numerous prizes, awards, and has publications featured in the Telegraph and Evening Standard. But her journey wasn't a straight line. In fact, she started as a mathematician and openly admitted she hated dental school, struggling to find her passion until her mentor changed everything. Today, we discuss that journey from book-smart student to world-class researcher. We dive deep into the systemic diseases linked to periodontitis and why she believes prevention is the future for profitable dentistry. This is a masterclass for anyone who feels lost in their career or wants to understand the true impact of the work we do as dentists. Let's get into it. Crystal, how are you doing today?
I'm good, thank you. How are you?
Very well, thanks. Very fun, thanks. For anyone who doesn't know, who are you?
So I'm Dr. Crystal Marruganti, and thank you for inviting me to this podcast. And I'm a dentist, and I trained in periodontology, both clinically and in research. Yeah.
And you mentioned there before our podcast discussion, right, that you were a researcher. You became a researcher because you didn't like dentistry. Talk us through that. Why did you become a researcher in the first place?
So basically, I started dental school by chance, to be fair. That's how it's always, I can become a dentist, I don't know. I've never even been so often to the dentist in a way, so I didn't even know what dentist life could be on a daily basis, honestly.
Okay.
So I started to study mathematics right after high school, and then I just liked numbers. And then after that, after approximately 6 months, got into dental school, and dentistry in Italy has just very, very limited spots in a way. So that's why a lot of people don't do dentistry in Italy. But anyway, so I got a spot, but just because in the entry test there are a lot of mathematical questions. So that's the only reason I got in, honestly. And so got in, and my parents were like, okay, I mean, the only chance that you have, you can study mathematics, like even when you're retired or whatever, whenever you want. So I started dentistry, and I honestly didn't like it. I felt like it was a downgrade from mathematics or something like that.
Yes. Interesting.
Because it's less reasoning, especially at the beginning, right? It does a lot of things that you just need to memorize.
Protocols
Right,
and yes.
protocols, and you feel that your brain is not like working enough in a way, right? So I didn't like dentistry, and I spent like 6 years of dentistry, because in Italy dentistry is 6 years, just to try and find a way out of dentistry, right?
Wow.
What did you try?
So I thought about, okay, I can probably, do dentistry and then move to the UK and then do, 3-4 years of medical school and then become a max fax. Or maybe, I didn't really want to start from scratch, because 6 years of university
Big investment.
is a lot of time, right? And if you just stop halfway through, you're just gonna have wasted like 4 years or 5 years of your life, which is a lot if you think about it. So I remember I had this professor like around the 4th year of dental school. That's where you start your dissertation project, usually in Italy. Okay. And he asked me to do like the dissertation project with him. He is the head of dental school now in Siena, in Italy, and he's an endodontist and restorative dentist. And I just replied to this guy like, I'm sorry, I just don't like dentistry. So I'm just book smart, which is something completely different. I'm just book smart, but I don't like dentistry. Like, I don't like teeth. I don't like to use burrs. I just don't care, I was in this phase, and then he was like, you know what? Like, maybe you can try with perio. And I was like,
because it's not teeth.
Because it's not exactly teeth, and you can do many things within perio. Like perio is very broad if you think about it. So
medical a little bit.
exactly. So it can have different variations. So from there, basically, he introduced me to the head of perio, and also he was like, "Oh, I know this guy who's Filippo Graziani is like probably is like one of the big perio guys, right?" And he does a lot of this research about connections with oral and systemic diseases. Maybe you can try, right? If you don't like teeth, this is something that's a little bit less clinical. And that's how I started since the 4th year of dental school to actually work on research. And since I was good with numbers, I started to learn like Stata, R, Python to do statistical analysis.
So the math came back in, right?
Yes.
Exactly. So I was like, okay, let's start from this. And that's what I've done probably basically from my 4th to the 6th year of dental school. And right after that, I started directly to do the PhD in clinical training in perio.
PhD in perio, wow, okay. How long did that take you?
Well, it was supposed to be basically 4 years, but in Italy the rule is that you need to have at least, I think it was like 4 or 5 publications within a minimum of 3 years. And I made it in, I think it was like 2 years and 10 months or something like that, from November 2020 to September 2020.
So you're like a machine. You just get them
So
done.
like, if I do this, I just want to get it done and get it done quickly because that's how I do things. That's just my energy.
Slowly.
Exactly. That's just my energy. So it wasn't easy because it was COVID times, because I graduated from my parents' living room, right, in July 2020, probably as most people have done at the time. Yep. And then right after that, I did the exam, and yes, November 2020 I started. But at the beginning, I was supposed to do one project about the association between periodontitis and psoriasis, but we couldn't bring more patients to the hospital clinic, to the university clinic, basically because of COVID, and COVID was very bad in Italy at the time.
Yes.
So I had to swap and do more like, let's say, epidemiological studies, observational studies with patients that were already attending the university clinic in a way. And that's why I got into the research of the association between lifestyles and perio, because I could assess lifestyles right before, after treatment in a cross-sectional kind of fashion in patients that were already inside the clinic, right?
So you just kind of went up to them and were like, what's your lifestyle like? Tell me about
with specific questionnaires. So I've dug in a lot of research, and then in the meantime I started also the other project, right, for psoriasis. And when I was able, of course, to bring more patients within the clinic, I started that one as well, and I'm still publishing the results from that. Okay. So I had to a little bit like change plan quickly.
So Crystal, you also mentioned you did some research on animals. How is that different to the seeing patients, of course?
So basically, I've done some research with animals, and I've used neural models to study the association between periodontitis and psoriasis. And we've done mainly 2 big studies. One was an association studies to check basically the biological mechanisms behind this association, and the other one was a study of treatment, meaning I have mice with periodontitis, I've got mice with psoriasis, and let me treat the periodontitis and the psoriasis, let me, combine the treatments and let me assess the outcomes. So these were the 2 treatments. The main difference is that when you see patients, of course, if you go into dentistry in a way, it's more likely that you become, or you already are, a little bit more of an extrovert in a way. While working with animals, I mean, you're alone most of the times with entities that do not talk.
Unless the parrots.
Exactly. That do not talk. Inducing perio and psoriasis in mice and working with mice is not easy because they are absolutely tiny. So
say like perio treatment as well. Did you do treatment on these mice?
Yes, we've done the treatment as well with hand instruments basically, and the protocol is hand instruments and chemical plaque control with chlorhexidine. Of course, you cannot use really ultrasonic scalers because again,
this is a
it
whole
doesn't
animal
fit in a
movement,
Ritz mouth.
Exactly.
Yeah.
Wouldn't work. Just wouldn't work. So yeah, I mean, it was quite different in this way. And then, of course, you've got all the components stemming from doing animal model studies, meaning histological analysis, micro-CT analysis, and also biochemical analysis. So all these kind of basic science, basics research kind of skills that are completely different from where you see the patient, you design the randomized controlled trial, you're calibrated, you take the clinical measurements, etc., etc. So there are completely different skills, but you should do everything throughout your PhD. Yeah. I wouldn't do it again, honestly, but it's done.
Okay, interesting, very interesting chapter.
Done and published.
So Crystal, going into university, you're pretty much a mathematician, right? You end up in dental school. You don't necessarily like patients, or you don't teach as much. Was there any point where you decided this is enough, I'm going to get out now? Or what kept you going? Was it just the fact that you're already so far in, or why did you stick around?
Because when I start something, I just want to finish it. Okay. Yes. I mean, honestly, I couldn't tell my parents. I went to dental school. I started mathematics. Then I said, okay, let's go to dental school. And I noticed that because everybody told me, you get to the 4th, 5th year of dental school, you start to do something, and then you're going to like it. Okay. So I waited until the 4th. Did
you not get that moment?
I didn't get the eureka moment. Wow. I didn't get it.
Okay.
No
way.
Didn't
get it, honestly. Didn't get it. So I was in a massive crisis because I was like, I just don't like it, because I couldn't see a bigger picture or I couldn't see a way out. But I was lucky enough that even the professor that I had, that I'm still working with, because he's still the head of the dental school where I'm a research fellow, is Professor Simone Grandini. He was like, instead of forcing me to do stuff, he was like, okay, let's take a step back and let's make you try something that may be closer to what you like. And that's what I'm still doing research on. So oral and systemic disease.
I think a lot of people have this experience, actually, because dentistry is one of those unique fields where you will never actually know what it's like to be a dentist until you become a dentist.
Exactly.
You didn't practice dentistry as a 16-year-old doing work experience, right? And it's a very unique position to be in. You're working on patients clinically. You have all of this theoretical knowledge. You also have to manage people, which is incredibly difficult, in a very vulnerable environment as well, for them, for you. So it's kind of like a lot of pressure, and especially if you're not a natural extrovert, like, it can be quite intimidating and difficult to manage. But I think what you've said is really inspiring, because a lot of students end up in a similar place to you, where they start dental school, everyone tells them, oh, just a couple of years of theory, just get through it, and then it'll be fine. But then they start the practical.
Sorry, the case.
Exactly. They start and I know so many, I've now graduated, and I have friends who tell me, like, I've spent 5-6 years of my life doing something where I don't feel passionately for it, and I'm just waiting for it to finish so that I can leave. But I think what's very interesting about your journey is that you've managed to find the parts of dentistry that you identify with and find interesting to you.
Yeah, I've been helped to do that, right? Because otherwise I would never have known that, right? So the good thing is that you need to find the right mentors, but not because you have to be like them, but because they care about your growth enough that they show you the way. Even though the way is not with them, in a way, it's not exactly what they do, but this guy redirected, to this guy, and I'm still working with both of them after years and years. And it's beautiful to see how, of course, my role changed, right? I used to be an undergrad, then I used to be a postgrad student, then I'm a research fellow. Now we're doing private courses with Filippo Graziani in Italy. We're probably going to do something in the UK. Then I'm teaching undergrad and postgrad as well. So it's funny how, if you care about the people around you, they will care about you, and they will also somehow guide you, but without forcing you, to do one way or the other, if that makes sense.
Very interesting. So Crystal, you found that passion now, right? Now you like what you do, right?
Yeah.
So you're in a better position now.
So, yeah. There's still time to change, but you never know.
What was the pivotal moment? Was there any point in your journey where you figured out, so you felt like, finally, I found my passion, this is my calling?
So for how my personality is, I am very cautious to say this, let's say, because I finished dental school and I started the PhD, and the PhD is just like being in a washing machine, right? Yeah. So it's like, because you start, you've got multiple projects, and a PhD is really, really worth doing it only if you get out of the PhD with your own publications, like strong publications and a strong identity as a researcher. So people should get to know you for a specific field of research, which is not just perio, right? Has to be, I don't know, perio and lifestyles or perio and psoriasis. Has to be something way more specific, okay? So honestly, after the PhD, which was September 2023, it was a difficult time because you finish the PhD and you're like, how the Latin would say, like horror vacui, right? Because you're like, oh my God, now what's going to happen, right? Yes, I can continue doing research, but what's the end point? So I wanted to be an academic like full time, right? That's why I originally moved to London, because I just needed to complete my PhD and everything. But then randomly I started to work in practice just because I just wanted to, when you do a lot of research, I didn't do a lot of grafting or a lot of, for example, complex surgical procedures. So I was like, okay, let me just find a practice and work just 1 day a week.
Okay.
Just to keep your hands in it.
Yes.
And was it the first time you saw patients after university, or were you still doing some clinical work in your PhD?
In clinical work in the PhD, of course, because I did my clinical training as well. But in the UK, I started to see patients again in May 2023, since I moved to the UK in 2022. Yeah, of course.
So it started off at 1 day a week. Where is it now?
1 day a week, and now it's 3 days and a half. Right? It will increase, but I can't increase because I don't have time. But
but somewhere along the way, you started to fall in love with, I assume, clinical dentistry, right? You like seeing patients. What part of dentistry interests you now? Why is it that what shifted with actually doing clinical hands-on treatment?
Basically, the fact that there are different ways to see patients and different ways to treat patients. I just focus my practice on periodontics. But again, even within periodontics, you can do perio in many, many different ways, right? So I try to actually implement and apply to the clinical practice whatever was found throughout the research that I've published and we've published with a team of research. So it's really a way to take what I've done and what I keep doing in research and translate it into actually improving patients' care in a way, both by improving patients' lifestyles, decreasing the prevalence of gum disease, but at the same time also taking care of what today would be called cosmetic periodontics, so grafting, crown lengthening, and really, really fine surgical techniques. So I also like this part because it after years and years of more theoretical work, it's like I'm actually exactly putting everything into practice.
Actually, so can you give us an example of how you think your work differs as a periodontist as compared to your colleagues who may not have had the same training and research experience that you have? With this exposure to the links between gum disease and overall health, how does that knowledge inform your practice and advice that you give your patients?
So the most important thing is, again, as we were talking about before, as soon as you meet the patient, you just need to speak with the patient and talk and ask information about lifestyles, ask information about their general health as well, right? And then based on that, we've got a lot of information about the patient's risk profile for many, many different diseases. It's not uncommon that I ask my patient to go and do like a full blood exam, for example, okay? And then also there are many different ways that you can somehow advise your patients with improving their lifestyles, okay? Using the make every contact count kind of pyramid. So you can signpost the patient to websites, to apps in order to improve their nutrition or reduce smoking cessation, for example, or improve the physical exercise or improve their sleep quality. So really, oral healthcare professionals we are the professionals that actually see the patients more often, right? Because you see the dentist way more often, the dentist or the hygienist as well, right? Way more often than what you see a GP, right? Or anyone else. So in terms of actually doing some kind of counseling or giving our patients some kind of advice on how to improve their lifestyles, will not only improve their gum health and their dental health, but will also improve their general health, reduce blood pressure, right? Reduce blood glucose and improve blood glucose control. So we are actually essential to do that, right? If you think about it. So this is actually the core of the research of lifestyles and perio that we've done so far.
Talk to me more about that, Crystal, because what you're known for, from what I understand, right, is that link, right?
Yeah.
Now in dental school, people who that aren't even dentists, maybe people who are non-dentists are watching this. You mentioned how teeth and oral healthcare can affect blood pressure. To what extent can one's oral health affect the wider body?
So let's say that there's a very, very interesting review that was published like approximately 10 years ago that says that periodontitis has been associated to approximately 57 systemic diseases. Now, of course, the strength of evidence of these kind of associations is not the same. The strongest associations that have been studied for more than, like, let's say, a couple of 3 decades are the associations between periodontitis and diabetes, periodontitis and blood pressure, I would say. Mm-hmm. And we've got evidence as to how, for example, patients with periodontitis, especially severe periodontitis, are at higher risk of having diabetes, and also vice versa. Kind of the same thing for blood pressure, but the more interesting results are about the efficacy of gum treatment, of periodontal treatment, in somehow reducing this kind of parameters. How does that happen? Mm-hmm. Usually the kind of design that I've also used to study the association between periodontitis and psoriasis is that we take patients, right, with periodontitis and with, for example, high blood pressure, right? Mm-hmm. We treat one group with gum disease treatment and we do not treat the other group. And then basically what we do, we just follow them up. And we see that, for example, the patients that received the gum disease treatment actually have a significantly lower, for example, systolic and diastolic blood pressure compared to patients that have not received gum disease treatment. And that's all roughly because of the reduction of inflammation and the improvements in oral microbiome. So there are usually 2 main pathways, the inflammation pathway and the microbiome kind of pathway, in order to put it very, very simply. And it's the same thing for diabetes, right? Especially now through the NHS, there are specific pathways that patients with diabetes should follow. Mm-hmm. So the GP or whoever, let's say whoever physician does the diagnosis of diabetes should absolutely signpost the patient to see a dentist first or a hygienist, at least to screen for periodontitis. And then, of course, if a referral is needed to a dentist or to a periodontist, of course, will be done. Because again, we know of the benefits of treating periodontitis in patients with diabetes. And these kind of improvements have been, let's say, shown to be comparable to taking a second hypoglycemic medication. So, for example, if a patient already takes metformin, right, to manage diabetes, and, for example, they see that they cannot manage diabetes, if the patient has perio and you treat the perio, quite likely that the reduction in glycated hemoglobin would be caused by the gum treatment would be enough so that the patient does not need to take another second hypoglycemic medication.
I think that's extra meaningful. I mean, here speaking to young dentists and undergraduate students, there's real meaning to the work that we do. It's not just drilling and filling, but it actually everything that you do in the mouth affects the rest of the body and affects people's overall health. And I think often the relationship between overall health and oral health is understated. Yeah. People say it, but they don't necessarily absorb how much of their impact there is. And I think hearing this really reinforces the fact that we have a responsibility to our patients. Yeah. To do good care, and especially when it comes to perio, I think it sometimes is a little bit neglected. Mm-hmm.
Yes, yeah. Why is that? Yeah, because dentistry is mainly a treatment-related kind of field of medicine.
The intervention. Right?
Yes, exactly. So basically, dentists earn more money the more treatments they do. Does it make sense? Yeah. That's probably and roughly how things are. So prevention doesn't really earn good money, so that's why most of the times some things like perio, you might find some clinicians that may say, oh, you just brush your teeth and perio will go. It's not exactly like that. But that's mainly why. The system is broken somehow, not just in the UK, but throughout, because of how intervention-related dentistry is. So yes, there has to be a way to change it, where prevention pays and gets paid as much as treatments and interventions, but that's mainly the reason why. And also because whenever you treat perio, it's way more difficult to communicate with a patient. Perio is a field of dentistry where you need to talk. I mean, I spend my days talking. Just speaking with the patient and trying to make them understand the importance of it. Because in a way, whenever you do whitening to a patient, the patient sees whiter teeth. And honestly, it's a little bit easier in terms of communication in perio, results are not necessarily always so straightforward.
Less tangible, right? Mm-hmm.
Yes, everything is less
Not
tangible.
just for the patient, by the way, but also for the dentist. Like speaking for myself, especially when learning to do perio in university, and maybe your technique is not 100%
Yeah.
at the beginning. So you're sitting there scraping, and you're like, "Is this really doing anything?"
Am I really doing the right thing?
But it's also like, as a clinician, I mean, when you have caries and you remove caries and you place a shiny white filling, it feels good. It feels very like rewarding to see the before and after so immediately. Whereas when treating perio, it's not just scaling teeth, but it's also that communication element, the diet element, the lifestyle element. There's so many factors that go into the perio health of a patient. And so as a clinician, it's very hard to feel that you have much control over that process, even with the gum treatment option. And so I think people maybe gravitate towards things that they feel that they can change.
Yeah.
Hard tissue, they can change hard tissue. Whereas soft tissue is a little bit more unpredictable, but actually, arguably, it causes a lot more impact on overall health.
Especially longer term, right?
Long term, yeah, 100%, 100%.
So I guess a question there then, Chris, off the back of that is, how can dentists actually monitor and see how perio or how periodontal health is changing with time? What can be done to tangibly see the results of that so you can actually monitor progress?
So first of all, especially for how regulations are in the UK, for example, if a general dentist, they see patients, first of all, they need to screen for gum disease, for periodontitis, and in order to do that, they're going to take the BPE, so the basic periodontal examination, right? So depending on the BPE, you can either decide to send the patient to the hygienist, and then, for example, have the hygienist have a round of non-surgical periodontal therapy, or decide to refer the patient, depending on the BPE code, to another dentist with special interest in perio, or to the periodontist, okay? And so basically, whenever the care of the patient shifts towards someone who just focuses their practice in perio, then of course they are going to be the one monitoring it in a way. But then when the active phase of treatment for perio is over, and then the patient comes back to see the hygienist for the supportive periodontal care, then the hygienist will somehow check the plaque, bleeding, and the indices throughout all the sessions. And then if needed, they will basically refer the patient back to the treating clinicians for perio. So the BPE cannot really be used for monitoring throughout time. But again, if the patient has received active therapy, of course, the hygienist doing the supportive periodontal care, or the clinician in general doing the supportive periodontal care, will monitor in a way, right? Because again, you need basically a 6-point pocket chart, a list of the areas where you know that the patient, for example, had residual pockets or residual areas of disease. So not really through the BPE, but already using the plaque and bleeding scores, they are a very good indicator of checking the stability of the patient, right? Because whenever the patient has very low compliance, it's only about time that they will relapse, right? So really checking plaque and bleeding, they're usually the key elements, yeah.
Okay, so you mentioned the hygienists and therapists, or hygienists rather, right? And how they have the active enforcement and of that stability, right? Because of course, if you neglect that, then you have relapse. Now, in the UK right now, how do you view hygienists being utilized? And do you think that more work should be done in integrating hygienists within the wider dental profession to ensure that ongoing support with patients occurs?
Honestly, I think that the figure of the hygienists and therapists are absolutely essential, especially within perio, in a way, because, for example, whenever I see a patient for consultation, right, according to the new guidelines for the treatment of periodontitis, we've got the 4 steps, steps 1, 2, 3, and 4, and most of the times, depending on the amount of supragingival buildup, I let the hygienist do the step 1, so the professional mechanical plaque removal and the oral hygiene instructions, etc. And then I see the patient directly for the step 2, which is the subgingival instrumentation. And then again, what is essential in order for the long-term stability of the patient is that the hygienists are completely integrated within the dental team and within the perio and hygiene team, because again, the supportive periodontal care is a big chunk of the treatment of the patient, but also of the patients coming to every practice, if you think about it.
Yes.
So the biggest chunk of treatment is the supportive periodontal care. You want most of your patients to just stay in supportive periodontal care. Whenever they're there, I honestly just want to see them for checkups once a year, right?
Yeah.
So they should be absolutely one of the key central figures, because even for perio and dental caries, they are the ones seeing more patients, right? And most of the times, whenever, even during the regular maintenance sessions, they see something that doesn't look right in a way, right? In terms of caries or in terms of perio, they are usually the big chunk of referrers to the general dentist or to any other type of specialist or dentist, basically. So their education and their role within the dental practice should absolutely be implemented, yeah.
Bringing it back to kind of your unique insight as being someone who has this background in understanding the relationship between lifestyle and gum disease, and also now having that more clinical touch in your career, what are some tips that you have for GDPs in order to help patients manage their perio and also bring in these elements of holistic care? Because I think a lot of GDPs maybe feel a little bit like it's maybe not their place, or they don't have the knowledge to back them up. So do you have any little nuggets of knowledge that maybe they can pass along?
So yes, perio feels quite intimate to talk about if you don't do perio every day,
Yeah.
right? Because it's like telling your patient, oh, you're not brushing your teeth, right? In a judgy way. So rule number one when you do perio, just don't be judgy, you know. If a patient tells you that they love smoking, that they're heavy smokers, tell them, you know that smoking is beautiful. You need to reinforce what they say, right? Because it's as if you're a teenager and your mom tells you do not go out and do not get drunk, and you do it anyway, right? You don't want to do that. So rule number one of motivation, just embrace it with the patient. Like, smoking is beautiful. Yes, I totally agree with you. I've never smoked in my whole life, but smoking is beautiful. So reinforce what the patient says, okay? That's number one. Number two, absolutely just take your time to just speak with the patient, because sometimes patients do not, it's not because they're lying to you, right? But it's more because they don't feel confident enough, right, to tell you things. So just basically start by talking about lifestyles, talking about physical exercise. And when you talk about perio, it's more about understanding the long-term consequences of not dealing with it, which is ideally progressively having also to do, for example, more and more treatment down the line, right? Because the more, for the longer you neglect the perio, the more the treatment that you're gonna need at some point, right?
Yeah.
And in terms of lifestyles, again, we've got a lot of resources nowadays, like online resources, apps. So a good way to start the conversation, what I do sometimes, to just open the website of the British Society of Perio. There are interesting videos, and if I see that the patient is not really on it, just talking to me, we just have a look at the videos together in a way.
Yeah.
And I'm like, because there are beautiful infographics as well. And I'm like, oh, you know, this happens if you don't treat perio, and you can improve your nutrition like this. Just replace butter with olive oil, for example, or just very simple things, right? We're not nutritionists or anything like that, but we can just give tiny, tiny tips and switch on, basically, the patient like this. Yeah.
Become more aware of their health.
Exactly. And it doesn't need to be like, they don't need to be like massive changes, but just a 1% change every day. But if you multiply it by 360, it becomes big, yeah.
Okay, very interesting. So Chris, you talked about your time, early days, when you weren't too interested in dentistry, and how that changed, that passion was found through research and that empirical investigation into what happens, right, and seeing from a bigger picture point of view. What are you at right now? Where's your mind at right now? Because Crystal today is a researcher out here, a clinician as well. What other things have you done that maybe is unconventional within the dental field?
So now honestly, since last year, doing research is a big thing, right? When you do research, you just do your research, you just think about your research, getting published, and you're obsessed with it. Then you think about your clinical stuff, and then you just think about your grafting, right? And how you want your graft to cover all the research. But then you understand that you're just making a small change, right? One patient at a time. So now I'm moving a little bit more towards education and towards divulgation as well, because people are becoming more and more self-aware also of their own health, if you think about it. So like earlier this year, the research that I've done has been awarded by Forbes, right? So it's a good way to somehow tell the general audience, look, we're not just dentists, okay? We're doing way more than we think. We're not just stealing your money, or we're doing way because that's a very common thought if you think about it, right? We're like the fake doctors. I don't know. There are many things that they usually say about dentists, right? So it's a way to just recognize that our work goes way beyond what traditionally is. So yes, now it's more about divulgation. There will be a book coming about this. It's a lot of work. I will still continue doing my research and my clinical work. But again, it's more about generating a massive, big change within the general audience as well.
Okay, so the passion, or I guess the focus is now also shifted, or another part of your passion is now the general public and educating on a mass level, rather than just a specialist periodontal or specialist dental interest, as it were, correct?
Yeah.
Okay, so you mentioned education on a wide level, right? And you mentioned Forbes. When a dentist appears in Forbes 13 to 30, what is the response to that like?
I mean, honestly, I wasn't really expecting it. So I was a little bit shocked. I was going to work in the morning, so I looked at it and I was like, okay, so what am I going to do with it, right? Because I'm not anxious, but I just want to get things done. So I was like, okay, now I need to do something with it. So what's next now, right? So it's, so yes, I think what came out of it for me, like even mentally, is to just really shift more towards divulgation and going back to more, education and generating like this bigger impact, also with the general audience, not only with students, and somehow causing a change for the profession, changing the profession from an intervention-related kind of profession to actually talking about prevention, talking about lifestyles, talking about things that usually dentists do not talk about, if you think about it, right? So that was it. It was a big thing, but it was quite interesting also to go to events and see other professionals from other fields of dentistry and from other fields of knowledge in general, right? Finance, arts, and communication. Because again, every profession has different ways to tackle problems and create solutions in a way. So it was very, very interesting to just be part of this community, honestly, yeah.
Okay, very, very cool. So you've also done some interesting work in the business space, right? You've also done some education in business. Talk about that. Why business? MBA. Where did that come from?
Because people that know me know that I'm quite hyperactive in a way. So sometimes I wake up in the morning, I'm like, maybe, I don't know, what if I studied to be a banker or to be a lawyer? You could be everything you want if you think about.
Mathematician to dentist, so this is the natural.
That's the natural tendency. That's why I don't want to stick to one thing for my whole life. So you never know, right? So I wanted to learn something different, but at the same time, I wanted to let's say, still be into dentistry, right? And what dentists usually are not trained for are for the business side of things. And if you think about it, dentistry, or when you're a dentist, right? Or when you're a clinician, and especially if you work in private practice, you're like a small brand, you're like a small company, right? So you need to understand what's your strongest suit, right? What's your strong point, what's your weakness, and why should people come and see you instead of seeing someone else, right?
Yes.
So, and it's a lot about managing your time, because in a way as clinicians, we're somehow trading our time with money as well, which is quite of a tricky thing if you think about it. And you should think about how can I make my time more meaningful, more rewarding, more effective. And these are all practical pieces of information that are not taught in dental school, because in dental school they just teach you how to do the practical things on the patient, but less about managing what's actually the dental profession, which can be managing a practice, which can be also managing yourself as a self-employed, which is like managing a small practice with one dentist, right?
Yes.
It's basically the same thing. So that's why. It's a lot of work, honestly. So,
Is the MBA done now, or whereabouts?
I will finish in October.
Okay.
Yes, and I can do most of it online because it's through Paris Business School, right? So yeah.
Once again, out of any business school in the world, you went to one of the best in the world. Paris Business School, iconic campus. Wow. Okay. Here's a question, Crystal, because of course you hear that entrepreneurs, business people learn through doing, right? You learn through the art of growing businesses through the action of scaling ventures, right? How do you think that reconciles or compares with what you can be taught in a classroom or through taught content? Do you think you can be taught the same level of business acumen and business skills through, let's say, a structured program like an MBA in comparison to starting your own business?
I think that the good thing about the MBA is the network that you can create while you do the MBA, right? You do not need an MBA in order to generate a successful business in a way, right? Most of the business side of things can be learned by if you find some mentors or if you just start your own business and somehow you've got some business sense and you can make it. So I wouldn't say that an MBA is essential to be an entrepreneur or to own a business the same way that you need dental school to be a dentist. It's not the same thing, especially because an MBA education is more like project related. So in my case, the MBA is mainly focused on like luxury goods, which can be anything, which can be healthcare, which can be a handbag, which can be wine, or which can be coffee or anything like that, right? And the good thing is that some of my colleague students, one is working for Mercedes, one is working for Gucci, like people just come from different fields and it's honestly so interesting to see how we are all faced with the same kind of project and everyone tries to solve the issue in a completely different way, right?
It's incredibly interesting.
If you think about it, but it just makes you grow so much, right? Because you see that the guy with a business kind of degree or economics degree, they have one approach, or I have like a different kind of approach. So that's the good thing. So it really, really helps you trigger that kind of lateral thinking that gives you, fresh ideas to solve old problems, right? So you've got the same issues, but you can solve the same kind of issue with different angulations, right? With different kind of strategies. So if you've got knowledge from other fields, you can apply that knowledge, which is how you do things, not the technical knowledge of dentistry, cardiology, or I don't know, whatever, right? It's not that. It's how you do things. It's a process. It's a system of doing things.
Like a way of thinking.
Yes, exactly. So, yes, that's the most rewarding thing, I think, yeah.
Very interesting. So, Crystal, it sounds like in most rooms you're in nowadays, right? You're normally the only dentist around, right? No, you're of course in all different spheres of life, and you seem to be someone who's kind of pushing the boundaries of what a dentist can do, right? Was that always your mindset from the outset, or what really is that part of your character? Would you say being somebody who pushes what's possible, or was there a moment that kind of changed that for you and you realized you could do more than just teeth?
Well, honestly, I think it might be a personality trait, honestly, because whatever I do, I just want to do more. I just, even if I do something like a wine certification, I'm like, okay, I've done level 1, now I need to do level 2, then I need to do level 3, then I take a diploma. It's just personality kind of thing, because the way you do things is irrespective of what you do, right? So it doesn't matter if you just do, I don't know, if you're just doing a filling, or if I'm doing, for example, a full arch or full mouth grafting, you have to have the same kind of level of excellence and of perfectionism while doing things. So whatever I do, even if I'm playing cards, I just want to do more. I just want to do more of it. So I think it might be a personality trait, honestly. So I decided to go into dentistry. I didn't like it. Somehow I found a way, and then I'll just, basically take it from there in a way. Yeah.
Along the way, the constant is you try to strive for excellence, right?
Yes, exactly. Because it's how you do things. Doesn't matter what you do. Even if you prep a coffee, has to be good. Perfect. Has to be perfect, So, and if you apply like that, if you apply this kind of way of thinking, you're never sloppy. Because the issue with dentistry is that it's a practical thing, and you want the first patient in the morning to receive the same level of care of the last patient in the evening, right? Yes. And that's the difficult part.
I was just going to say that actually. Yes. In healthcare, I think a lot of people have this clash because they think that because you're selling something to your patients, which is your time and your expertise and your care, that there's a conflict of interest because it means that you don't want what's best for them. But actually, the fact that you are charging them is irrelevant because what you want is to be the best and to provide the best for your patients.
Absolutely.
And I think that when people hear the kind of words that you're saying and feel that through your actions, that's how you can become an incredible dentist. It's not about each moment being perfect, but it's about striving for excellence and having your patients feel that as well. And then they're comfortable. They'll pay whatever they need to pay because they know that you're doing whatever you're doing out of pursuit of being the best and giving them the best.
Well done. Well done. Exactly. Exactly.
Okay, so Crystal, talk us through how the change was from growing up in the Italian countryside, as it were, to coming to the big city of London. How have you found that? How have you found that transition?
It was very. I mean, at the beginning, when I moved to London, the first 6 months, it was amazing, right? London is full of possibilities. You don't feel that London is busy, right? You just feel the possibility. And I remember every time I finished at university, 6 p.m., and I used to live in Highgate at the time, right? Beautiful, but not super central, right? And then I used to meet with my friends who used to live in Clapham Junction, and we just used to meet halfway, and we were like full of energy, and you were like staying like 45 minutes in the tube because you just wanted to just experience London. And now I barely get out of my neighborhood, honestly. I just get out of my neighborhood to go to work. So, and now I feel that it's busy, honestly. There are some structural differences with regards how, of course, the academic life is, for example, right?
So talk us through that, because UCL from Italy, how is the change in faculty like?
Yes, so UCL is a massive institution, it's a big, big university, while the university in Italy that I'm in is one of the best dental schools in Italy, but it's like a smaller dental school, right? And of course, there are positives and negatives to both. So when you are doing a PhD, for example, in a big institution like UCL, you've got all the resources in the world that you need, especially when you're doing a PhD. Yes. So you have, if you want a statistician, you have a statistician. You can have a biologist. You've got everything that you need, right? Exactly. So you can say, oh, I need a statistician or I need a biologist, and you can have all of these things. Well, of course. And this has good thing because you can access high-level resources. Of course, if you do the PhD in a smaller university, I had to do everything by myself, basically. I've done animal models, I've done cytokines analysis, I've done microRNA analysis, I've done clinical research. I've done pretty much everything there was to do there, honestly. So you just learn how to push yourself outside of the comfort zone and just do what needs to be done in order to get the job done, if that makes sense. So there are many advantages to being in a less structured environment because you can progress way quicker. Does it make sense, right? Because then whatever you do, it's all, let's say, yours in terms of contribution. Of course, the advantages to be in a big institution like UCL is that it's very structured. You've got loads and loads of support, so you need to figure less things out by yourself in a way.
Yes.
So you feel more supported. But again, if you just like to do things at your own pace, right, because you want to push and push and push, of course, it's a little bit more difficult because the environment is way more structured, right? Yes. As with everything in life, right? So the reason why also I managed to do so much in such a short time is also because I come from a smaller university.
You can do it all yourself.
Yes, of course, if you want to work, if you want to do online courses for statistics, and you can learn pretty much everything, in 2025, if you think about it. It's a lot of work, it's less supported, but if you've got your vision and you just want to do it, you've got your passion and you just get it done, then of course the reward is very big if you think about it.
Okay, awesome. So. Very interesting. So Crystal, mathematician,
yes,
dentist, what's next?
That's a very big question. So for sure, yes, it's the divulgation part, but at some point I'm more into just creating new oral healthcare products, basically. So just really, really having something by myself, basically. Yeah, something that's my own, like new oral healthcare products based on the research that we're doing also on new adjunctives to periodontal therapy, for example. And probably at some point I will stop treating patients, as would any dentist would do at some point. But it's more about creating something that's my own, based on all the research that I've done, right? So it's more about that.
Okay, very interesting. That's a bit of a sneak teaser, a preview of what's to come. I'm sure all will be real in due course. So Crystal, along the way, you've done many great things, right? From the externality, from someone looking in, from my perspective, from the outside, great accomplishments. Yes. How about for yourself? What does true success mean to you?
Well, I think success is more like when you have a vision, and you've been having a vision since you were like, I don't know, probably 18, 19, and at some point you just wake up one morning and you see your vision that became reality in a way, right? But also in terms of performance, success is also when you've had your setbacks, but then at some point you see yourself, you envision yourself just coming out stronger than you were before. So success is basically how high you bounce back after you've hit the bottom, because it happens to everyone in a way. So it's more about how you react, and that's when you're actually successful. So you're not successful just when you're on top. That's the outcome of all the steps that you've taken before. So there's not a level to be taken into account, if that makes sense, yeah.
Awesome. Thank you very much, Crystal. Absolute pleasure. There we are. Got it there.
Thank you.